I'm Dr. Samia Roohi, working as a specialist family medicine in the Department of Internal Medicine in Zulekha Hospital, Sharjah. I started my career as a GP in Zulekha Hospital, and I was working as an ER physician that time. It is way back 12 years back, 12, 15 years back. I served as ER physician for a couple of years, and then I passed my exams from Royal College of General Practitioners, and I was promoted as a specialist family medicine in the same hospital where I'm working now. This journey has been really awesome because I would say that in the same hospital where I start my career, and I have gained a lot of practice and primary care treatment for my dear patients. I have gained a lot of confidence in my in the society around, where the patients trust you and they get confidence in getting treatment with me. So that was one thing which really I found was great. In terms of my continuous professional development, I'm into presently into MRCP. It's at the last stage, and also I'm going for the acute medicine MRCP soon. I'll be appearing for the exam next month, inshallah. That's all so far regarding my career. Also, in my hospital, I work as an infection control physician since 2010. I have been having a great role in formulating the policies and protocols in framing the practices, infection control practice protocols. And since then, I'm on move. Let's hope it will continue the journey. The essential hypertension, where the definite cause is not there, and which has extended and gone down to the age limits. It has the most common factor which I come across is stress. I can keep it at the top level. You know the present scenario of the world. It's so disturbing with this COVID uprising and all. We have seen definitely a surge in these cases. And second most common factor is patient's lifestyle. His weight, the habits like smoking, alcohol, sedentary life habits, lack of exercise. These appear to be at the top most causes of the hypertension. And rest other causes can be some patients may, like some people will binge too much on the coffee or tea. That can contribute to transient rise of blood pressure that may not be actually giving them good persistent high blood pressure. But these are also the contributory factors besides the family history. Genetics play a key role in this type of hypertension. Well, physicians need to have their antennas. I always say that they need to have their antennas open always. It's not like the essential hypertension per se, with all these factors I told, has to be kept in mind. We have to be able to treat the comorbidities as well. We should have a know-how of comorbidities, which can lead to this track for the patient. Because so many things like diabetes or other dyslipidemic patients for no reasons, even primary dyslipidemias, ultimately those patients all end up in high blood pressure. So if we cut it at the beginning, if we control the comorbidities to some extent, I strongly believe, and I have seen this, the blood pressure is really, we can control the blood pressure at some point of time. So I strongly believe that besides the blood pressure per se, we should have a well knowledge of managing comorbidities. We are coming across with certain kind of patients who are who have been recorded as the high blood pressure, but who deny any high blood pressure history or having any symptoms at home. So these patients usually, the term has come from, the doctors wearing white coats, and basically it doesn't relate actually with the white coat. It relates to patient coming to hospital for some other reason, and they get surge in blood pressure that time. Probably these patients are anxious patients. They are too much concerned about their health, and that gives them a little bit of surge in the high blood pressure, what we call as white coat hypertension. This is very important to diagnose white coat hypertension, because it can lead to the disaster if it is persistent. Even if it's not persistent, even if the spike is for some period of time, the studies have shown that this can also lead to cardiovascular events. So we need to be fully aware of the white coat hypertension. Is it true white coat hypertension, or the patient has a masked blood pressure, which sometimes, they have blood pressure, but they have a denial. They don't accept that they are having a high blood pressure. In that case, we are counseling patients, we are educating them to record the blood pressure at home. Or we have we can put a cuff on their hand and advise them for ambulatory, what we call as ambulatory blood pressure monitor. That's a 24-hour run blood pressure, though gives inconvenience to patient with that instrument carrying on all the time and all, but then it gives us every 10-20 minute recording of the blood pressure. It has been really very helpful to record whether the patient is having a blood pressure which is white coat, or he really has so many spikes which needs attention. Well, I believe that this complete counts, like lipid profiles, as we keep on checking, it's very important. At least once a year, patient should have his background, because nowadays we have reached up to the conclusion, the lesser the LDL, the better. There's no cutoff point. It's not like below 100 you are safe. No one is safe, even with the low. We have seen patients landing up in myocardial infarction with low LDLs. But that's why we want to catch it at the earliest. So yearly checkups or 6-monthly checkups, more frequent checkups in those who are having risk factors for them. This is really very important. And uric acid, yes, it is also to be checked timely. And when we feel that they are little bit of above the normal, we have to treat them. I usually prescribe patients statins even if it's a primary dyslipidemia. I do prescribe the statins because this has definitely saved many patients. I think we should, above certain limits, we should treat both hyperuricemias as well as dyslipidemia. We should not leave it, because many times when we give lifestyle modification, they do it stringently. Some patients, 2%, 4%, 10% might do it stringently, but they come back to the normal after 2 months. And especially in this part of the world, food is so accessible. It's very hard for people to stay on diet, and weather is very hot. They can't make it continuously on exercise also. So these factors are very important. UAE has a study of MIs in early age, in young age. So I think that we should start treating these ailments at the earliest, and we should catch them at the earliest. We should screen them at the earliest. Continuous professional development is the key and cornerstone of a successful doctor. Success doesn't come in terms of just money. If your patient gets well, he is out of his ailment, you really are a good doctor. When your patient says that, yes, I'm happy with you, you are done. And continuous professional development is what I say. One should not get into stagnation. He should not stay where he is staying. He should keep growing. It's always like when my patients get well and they really are happy, I see smile on their face, I feel the same. I always feel that, Alhamdulillah, I have been in this position to bring a smile on their face by the grace of Allah, of course. But it's really when patient gets well, when patient comes to us, they treat you as something, as if you're going to treat everything. Even their own problems they discuss with you. And for me, I have really a holistic approach towards patient. I don't just treat their diseases, I treat them as a whole, their problems as well. That makes the treatment complete, actually. There are many such experiences which I have experienced. One of that is one child came to me. He was having a lot of problems, but the problems were not such that the parents were really stressed, that they were not able to understand. Like a child was not concentrating in studies. He was normal. His IQ was fine and all. Then I had a long chat with the patient and their parents. Then we realized that it was something at the home, sibling rivalry, which were not picked. Parents thought that the small child is okay, he is also welcome, and big child is also welcome. That day when I realized that how child had felt, and parents even didn't realize that it was. And when I discussed and when I counseled the child, he had cried a lot, and parents were surprised when they heard about that, because he was a mature boy and the other little girl was little girl, and there was nothing, parents, they had least concept of that, that this is because of that. And when you basically treat the underlying cause, you dig deep into it, why there is the problem. When you I told the patient, parents of the patient, to stay outside, and I talked to the, and I realized this was it. I was then after that time when they came to me, they had got a counseling sessions done for the child, and they changed their lifestyle and the way they were approaching to their, they were really happy, and the son was also then happy. And this was one kind of a moment. So many moments are there when patients get well and they go home. We get really happy and satisfied with that.